luteal phase is one of the stages in menstrual cycle that occurs after ovulation and before period starts. The lining of uterus starts thicker if enough progesterone is released to prepare for possible pregnancy. The lining that do not grow properly because of lack of progesterone, making the process of pregnancy difficult. This is called luteal phase defect.
Hi, Assalamualaikum. My name is Nur Emilia Natasha binti Rahim. So next, I will talk about the symptoms of luteal phase defect. Some symptoms of luteal phase defect include the spotting between periods, difficulty conceiving, miscarriage, bloating, headaches, breast swelling, pain or tenderness, mood change, and weight gain.
The first cause of luteal phase defect is endometriosis. Tissue that resemble the uterus lining develop outside of the uterus, resulting in discomfort and infertility. The tissue can develop anywhere in the body area, especially in the pelvic area. So, as you can see in this picture, the tissue develop at the ovaries, along the fallopian tube, at the tissue that support uterus, and outside the uterus. Women that suffers from endometriosis will feel pain because the tissue not expelled during menstruation, which can lead to formation of scars and inflammation. According to World Health Organization (WHO), endometriosis affects roughly 10%. About 190 million of reproductive age women and girls globally. The next cause is hypothyroidism. Hypothyroidism is a condition where there are too little thyroid hormone was produced. The luteal phase, which is the interval between ovulation and the beginning of your period, might become short in hypothyroid women. An embryo may not implant if a woman has a short luteal phase. Women could potentially experience irregular or no ovulation that lead to infertility. The body do not produce much progesterone like women with longer luteal phase. So, this can lead to infertility and luteal phase defect.
So next, a fine hormonal balance regulates the menstrual cycle. Overweight and obese women have a higher level of hormone called leptin. This can disrupt the hormone balance and lead to reduced fertility. Excess weight, particularly excess abdominal fat, is linked to the insulin resistance when the body has to produce more insulin to keep the blood sugar level normal, and it decreases level of the sex hormone binding globulin, a protein that is involved in the regulation of the sex hormone androgen and estrogen. This increases the risk of irregular menstrual cycle, which in turn reduces fertility. One study found women who were obese were much less likely to conceive within 1 year of stopping contraception than women in a normal weight range. 66.4% of obese women conceive within 12 months, compared with the 81.4% of women of a normal weight. Changes in the fine-tuned hormonal balance that regulate the menstrual cycle triggered by the excess weight and obesity also increase the risk of anovulation when no egg is released by the ovary. Women with a body mass index above 27 are 3 times more likely than women in a normal weight range to be unable to conceive because they don't ovulate. As we know that exercise is good in maintaining healthy weight and improve cardiovascular health, but vigorous or extreme exercise can have profound effects in female fertility. The reproductive system is highly sensitive to energy deficit. Body weight and body fat composition have bearing on the female fertility. In an attempt to conserve energy triggered by an energy deficiency, alter the productions and the pulsatility of the reproductive hormone, at all levels of hypothalamic pituitary ovarian axis. As such, estrogen and progesterone concentration decline, resulting in a spectrum of exercise-associated menstrual disturbance (EAMD). Progesterone is required for preparation of the lining of the uterus for implantation and for support of pregnancy. When the level are low, poor implantation may occur. This is why vigorous or extreme exercise can lead to the luteal phase defects and may decrease the fertility in women even with the normal weight.
Another cause for luteal phase defect is polycystic ovarian syndrome or PCOS. So PCOS may affect the production of the hormones in the ovaries and the maturation of the follicles. So this ovaries disorder can lead to luteal phase defect by two factors. One is that one of the presence of the many underdeveloped follicles in the ovaries that cause the obstruction to the ovulation. So second factor is low secretion of progesterone and estrogen of the hormone affecting the ovary. And this affects the development and the growth of the oocytes and the corpus luteum. These factors end up lead to the thin endometrium layer that affects the growth and development of the fetus in the early pregnancy.
Lastly is anorexia nervosa. According to my clinic, anorexia is defined as an eating disorder where she does not allow herself to eat normally due to scared of gaining weight. In fact, anorexia is considered to be one of the most deadly psychiatric disorders. So, how this eating disorder can affect the fertility of woman herself? Since women with anorexia tend to restrain herself to eat or just eating only the excessive low-calorie diet, she does not get enough nutrition in her body. Our body needs a variety of nutrients such as vitamins, proteins, minerals, and proper hydration to growth and synthesis hormone for reproduction. If our body does not get essential nutrients, then our egg cells may be poor quality, as researchers have discovered the connections between quality of a person's diet and their fertility outcome. Next is anorexia can lead to decreasing levels in leptin hormone, which play roles in ovary function. Anorexia also causes irregular menstrual cycle. Based on some studies, between 66 and 84% of women with anorexia nervosa do not get period, and between 6 and 11% have irregular periods. Irregular periods lead to irregular ovulations, and irregular ovulation can cause difficulty in getting pregnant.
I will continue with the diagnosis suggested for the luteal phase defects. Firstly, doctors may suggest taking blood tests in order to measure the levels of several hormones such as the level of FSH, which is follicle-stimulating hormone, luteinizing hormone LH, and the level of progesterone. This is because a luteal phase defect can occur when ovaries don't release enough level of progesterone or the uterus lining does not respond to the hormone. Another way for LPD or luteal phase defect diagnosis is by getting a pelvic ultrasound. So this is when the doctor measures the thickness of the uterus lining of the patient. This is due to the luteal phase defect that inhibits the uterine lining growth, which is required for the egg implantation and the fetal development.
Next, we go for treatments. Firstly, we have progesterone injections. As we all know, progesterone is a vital hormone for women before and during pregnancy, as it helps to thickening the endometrium lining and promote the implantations of the fertilized egg in the uterus to establish a pregnancy. If a pregnancy does not take place, a progesterone level will fall and have a period. If an embryo implant into the lining of the uterus, the ovary will produce progesterone until 8 weeks into the pregnancy. After that, progesterone will be produced by placenta throughout the rest of pregnancy. Since luteal phase defects LPD reduce the level of progesterone, the corpus luteum may not develop properly. Moreover, progesterone is often given in fertility treatment like in vitro fertilizations (IVF). During an IVF cycle, the doctor will prescribe a progesterone supplement to put it right for this decrease in ovary ability to make progesterone, because in that way an embryo can implant and grow inside the uterus. Second treatment we have is clomiphene citrates or clomid. Clomid is a medication that is commonly used for treatment of infertility. It is often used to attempt to induce ovulation in women that is not developed and release an egg on their own. That is why it is called as an ovulation-inducing fertility drug. So, how this medication help fertility problems? Clomid works as an anti-estrogen that tricks the brain onto thinking that estrogen level in the body are very low. It does that by binding to estrogen receptor in the brain and blocking the ability of estrogen to bind to those receptors. The brain then thinks that estrogen levels are very low, so it releases GnRH hormone, which goes to pituitary gland and stimulate release of LH and FSH. These actions stimulate the growth of ovarian follicle and thus initiate ovulation. Approximately 75% of women with ovulating dysfunction will ovulate in response to clomid. Therefore, clomid often prescribed by the doctor for women who has PCOS, polycystic ovary syndrome. Lastly, we have human chorionic gonadotropin injections or HCG injections. HCG injections are sometimes used in fertility treatment to cause an egg to mature and ovulate. HCG injection also help to maintain high level of progesterone, which is critical for the success of pregnancy. Since HCG is similar in structure to LH, so when there is a mature egg follicle in ovary, an injection of HCG can cause the egg to mature and be released. However, in a normal pregnant woman, her HCG is produced normally by placenta to help the embryo implant and grow up in the endometrium effectively. Normally, a new mom-to-be will have symptoms like morning sickness, vomiting, and dizziness due to rising of HCG hormones.
Luteal phase defect (LPD) is a relatively uncommon but important cause of infertility or habitual abortion. So, the causes of LPD include endometriosis, hypothyroidism, obesity, extreme exercise, polycystic ovary syndrome or PCOS, and anorexia. So, the treatments for LPD or luteal phase defect are progesterone injection, clomiphene citrate, and human chorionic gonadotropin (HCG) injection. That's all from us. Thank you.